Welcome back. We are glad you are still keeping us company. This is Good Morning Kenya. In case you are just joining us, karibu tena sana. Remember, we'd love to know where you are watching us from, so feel free to interact with us. Check in. Use the hashtag Good Morning Kenya on Twitter. Official station handle ever remains to be at KBC Channel 1. And do remember to tag me. My handle is at Jain Wambui. We now get into our health conversation for the day. And as promised earlier, given we are in October, Pinktober, we all know October is the International Breast Cancer Awareness Month, and that is what we want to talk about today. Create more awareness around breast cancer, understand how far we have come as a country, and you know what more needs to be done to just make sure that breast cancer is not the menace that it currently is, not just in Kenya, not just in Africa, but the world over. With me in studio, I have two brilliant ladies who have joined to help with this conversation. I'll start by introducing you to the lady to my immediate right. She is Nancy Awuor, who is a breast cancer warrior. Good morning, Nancy.
Morning too.
Karibu sana, Good Morning Kenya.
Thanks very much.
All right. And we also have Dr. Joyce Kinyanjui, who is a clinician working with a Texas Cancer Center. Good morning, doctor.
Morning.
Karibu sana, Good Morning Kenya.
Thank you.
Thank you for making time to be with us today. We hope to get to understand, by the time we close this conversation, we hope to be better empowered. Now remember, questions, comments, clarifications, we welcome them. We are here to help you know better as we also get to learn from this conversation. So let me start with you, Dr. Joyce. When we talk about breast cancer, from what you have seen interacting with the different ladies and the different patients that you have interacted with at Texas Cancer, how are we doing in terms of the numbers and the prevalence that you have been seeing?
We can say breast cancer is among the top 5 cancers worldwide, with breast cancer leading with 29%.
Yes.
Yeah, so it's common in women and it's also common in men, with 99% being women, and the 1% being male.
And we're going to be actually questioning that male factor, because for so many people, when we talk about breast cancer, we just think of the ladies.
Yeah.
And on the other hand, we have our male counterparts, and we'll be knowing how they are affected by breast cancer. Nancy, let me come to you. You know, just going back with your journey fighting breast cancer, tell us a bit about it. Ilianza wakati upi? How was that time?
It started with a small lump in 2015. So the lump started growing. So after some times I decided to go to the doctor so that the lump could be checked. So I did so many tests, including mammogram, FNA, and biopsy. So at last the biopsy got that it was cancer stage 2B. So from there is how the journey started. So after getting that you have cancer, you know it's very painful.
Yes.
For you and also for the family. So they feel it's so hard, and you know the way cancer is so expensive and the way it affects the family.
Yeah.
So after that, I went for surgery where the breast was removed. It's called mastectomy.
Yeah.
So the whole breast was removed. So after the breast was removed, after 1 month, I started chemotherapy.
Now, is there any history of breast cancer in your family that you're aware of?
No.
None that has been, at least within your best knowledge?
No.
Okay. Now, just hold it right there. We'll be coming back to get to know more from your journey. But let me come to you, Dr. Joyce. Looking at the predisposing factors for breast cancer, what are they?
You ask about the risk factors.
What predisposes you to actually have the probability of getting the cancer developing, breast cancer specifically?
One of the factors is the sex, being a female. You are at
By
a higher
virtue of that.
Yes, you are at a higher risk of getting breast cancer than a male. Also, we have alcohol use, cigarette smoking, use of contraceptives, that is long-term use of contraceptives, which predisposes you because of the hormone factor. We have genetic factors. You find that if there is a history of breast cancer in a family, chances of 1 or 2 persons having the cancer in the lineage are high.
It's higher.
Yeah.
Oh, wow. Now, and looking at all those factors, which one has been seen to be the most, or rather the biggest cause of breast cancer? Is it the genetics? Is it about the lifestyle, or the hormonal changes that come as a result of using these contraceptives?
We can say lifestyle, and also genetic factors, and also the genetic factors, and also from lifestyle changes.
Okay.
Yeah.
Now let me come to you, Nancy. Looking at the journey, you've already been diagnosed with stage 2.
Yeah.
Yes,
stage
2. Were you able to sort of get more information around what could have exposed you to getting the cancer, or you weren't able to get that information?
No, I didn't get that information, but the way I just thought maybe long term of contraceptive. I used about 20 years of contraceptive.
When you're on contraceptive.
Yeah. Or maybe it's lifestyle, because it's not in the family.
It's not in the family.
Yeah.
Now, what was it that prompted you to even feel for, or even check and question what you felt when you were feeling around your breast, the lump?
There was a time I was bathing. I just felt some sharp pain. So when I started touching it, I just got the lump. But at first, I didn't think it was anything.
Were there any other signs that were presenting themselves before you you felt the lump?
I had a lymph node on the armpit.
Under the armpit, yeah.
So that one was alarming. So when I went to the doctor, he told me, this one we have to do a lot of tests because of the lymph nodes. So the lymph nodes
were inflamed.
Yeah.
Okay.
But they were not painful. Yeah, but only that there were some swells there.
Okay. And maybe you could even tell us, Doc, what are some of those signs that, we might be blind to, but actually they are pointing to there being, reason for concern, and especially around breast cancer?
Okay, for breast cancer, the signs, most of the signs, probably you can get a lump on your breast. There could be an inflamed lymph node on the armpit.
Yeah.
There could be skin color changes on the breast, like you find there is darkening of the skin around the breast.
Yes.
There is also dimpling. The skin starts getting dimples, then it looks like that.
That were not previously there.
Yeah, that were not previously there. And then there is that the skin looks some sort of like you see how an orange looks like the skin. Yeah, the skin looks like that.
Okay.
There could also be the nipple gets retracted. It gets to, like, it's getting to the insider. There could also be a nipple discharge, bloody or clear. There could be pain or no pain. Yeah, those are the most common signs
that you need to look out for.
Yeah, that you need to look out for.
I was actually waiting for the pain part, because Nancy did mention that there was pain.
Oh, no, I didn't feel any pain.
Yes.
It was not painful.
No, around when you felt the lump?
No.
There wasn't pain?
No, there wasn't pain.
Okay.
Yeah.
Now, getting to get the diagnosis, looking at the process of getting a proper diagnosis, because I feel this is also an area that most of us, the kawaida mwananchi, might not be really alive to. How is that done so that we know, if somebody who is watching us today, they understand that they are on the right path? The diagnosis for breast cancer.
Okay, once you realize you have a lump, you can go for testing. First, you come to the doctor who does a clinical examination.
Physically,
yeah.
Okay.
You check where the position of the lump, the size of the lump, and then you send probably for tests. You can do, if the patient is below 40 years, you can do an ultrasound. If they are above 40 years, you can do a mammogram. Then once the mammogram shows there is a lump and the ultrasound shows there is a lump, you can send for a biopsy, depending with the size of the lump.
Yes.
And the position of the lump.
Okay.
You can send for a biopsy. Once you do a biopsy, it will be able to give you the diagnosis.
All right.
Yeah, whether it is cancer or not.
Yeah. Now, there's a question that has come in here, and then I would like to seek clarification from you, looking at the medical standing behind it. Someone is looking at some of the risk factors that are involved when it comes to getting breast cancer, and this is a lady, name withheld. They're asking about, rather, she says she read somewhere that dense breasts could be a risk factor to getting breast cancer. Is there any scientific backing to that?
No.
There isn't any scientific research that actually supports such.
But basically, obesity in general,
Yes.
it is among the risk factors. Yeah.
All right, so I think that clears that. I don't want to add that because Mimi si daktari, only but also a learner in this particular conversation. Again, this is what I'm all about. Questions, comments, clarifications. Woo, my roots. Clarifications, we welcome them, as simple or as grand as they may be. Now, let's talk a bit about men and breast cancer. Do men get breast cancer? Let's
Yes,
start
they
there.
Yes, they do.
They do get breast cancer?
Yes.
And how is it different from breast cancer that women get to experience, if there's any difference?
I can say the difference could be due to the, our
Physical
breast,
anatomy.
yeah, the physical anatomy, as we have more fatty tissues on the breast, and the men, they tend not to have. So once they get the lump, probably they can't even get to know they have the lump. And again, men, they are okay. I may not use the word difficult, but it's not easy for them to touch themselves and probably examine themselves. But they do get breast cancer. They might get also lumps, nipple discharge, also swellings on the armpit. Yeah.
So the signs and symptoms are pretty much almost
They are
the same.
always the same, yeah.
Difference is probably when it comes to the detection of the lumps.
Yes.
All right. Now, let me come back to you, Nancy. Looking at going back to that time, you've gotten the diagnosis and you've undergone surgery, and now you have to go through chemo. How was that experience for you?
After surgery,
Yeah.
after surgery, I went for chemo. So chemo was the hell. It's so painful. So when they do the chemo, they put the injection and the medicine into your blood. So the side effects, they affect seriously.
And what are some of those side effects that you personally experienced?
First, you start vomiting. Then at times the body starts changing. The body color, it's changed to black.
Your
Even the
complexion
nails
darkens.
Yeah, it darkens. Even the nails turns black and they become so light. Me, I had even my nails were falling. But now it's okay. Even the hair, every part of the body where there is hair, it had to fall. I didn't have any hair. Even the eyebrows were not there. So the chemo is the what can I say?
It was a very hard time.
It's very
and
tight. It's
experience.
very hard experience. You vomit, you don't eat, appetite loss, moods, even moods. You just see somebody like this, you just feel, no, I don't want to see that person.
Yeah.
Yeah, it's not easy.
Now, do you think when it comes to the treatment period, when a patient is undergoing the treatment for breast cancer, is also one of the hardest times that, isn't really talked about by both the family, the medical practitioners? It's just left for the patient to, handle it because they've already gotten the surgery?
Yeah, mostly they leave it to the patients.
Yeah.
Yeah, you just have it, the doctor comes and puts it for you. They don't even care about the side effects. They'll tell you that it's normal, you have to have the side effects, but you just have to get the treatment.
And how do you feel, even the families of the patient undergoing the treatment can step in and assist in whatever shape, manner, or form to help make the journey easier for the individual who's undergoing treatment?
Yeah, they can chip in mostly financially because cancer is so expensive treating. So the family goes through a lot treating the cancer. So even the caregivers, even with them, they should have their time that the cancer caregivers month is really hectic for them. And you just know when somebody has cancer in the family, it drains you financially. So it's not easy even for the caregivers and the family.
All right. And after you are done with the chemo, are you done?
Yeah.
Let me not presume.
Yeah, I'm done. I'm done. Yeah.
And has there been any signs of recurrence that you have seen from the follow-ups that you have gotten to go with your doctor?
No, for now, not.
No
I've taken
recurrence.
4 years now.
Beautiful. And we're here to celebrate that.
Yeah, I'm celebrating it.
Good stuff. 4 strong years.
Yeah, 4 strong
Now,
years.
let me come to you, Dr. Joyce. You know, there's conversation around cancer recurring, and we've seen so many people, they have undergone surgery, undergone chemotherapy, all those forms of treatment, but after some time it comes to, you know, it develops again. And I have heard some experts refer to it as secondary. Tell us a bit about what prompts a cancer to recur.
Okay, once you have cancer, you probably, like now, for example, in her case, she had the breast removed, and also she had chemotherapy and radiotherapy, and then now she's doing okay. After you've gone for treatment, we insist on follow-up, because probably as they were doing the mastectomy, there were some remnant cells that were left there, and they're still growing, so that could be predispose the patient to having a recurrence. So we encourage patients to keep following up, because chemotherapy, radiotherapy is not 100% that there'll be cure.
All right.
Yeah, there could be response, there could be no response.
It's very different for every individual.
Yes, it's very different.
All right. Now, there's a board here that I'd like for you to take us through, and also maybe you could even show us, you know, when it comes to doing the physical examination on yourself, how one could go about it. And this goes for both ladies and gentlemen. Victor, Olo, wherever you are, I hope you're paying attention. All right? Let's go, Daktari.
Okay, this is what you should look out for. Probably we start from here.
Yes.
If you see a rash or something crusting on the nipple, around the nipple, some rashes, some pimples on the nipple, that is something to cause alarm. There could be change in size or shape of the breast. You find out that it's growing bigger and bigger than the other one. That is something to worry about.
But that even happens, so, you know, when you're going through your menstrual cycle, I'm sure so many women have noticed there's some physiological changes that get to happen.
But now for breast cancer, it is something that is growing. Like you can see, there's a very big difference, not like the normal one during ovulation and all that. For breast cancer, you find that it's quite abnormal.
And
you
the growth rate is
the
big
difference. Yeah.
All right.
Yeah.
Okay.
Lumps and thickening of the breast. If you touch yourself and you feel a lump anywhere, and probably it's growing in size, you should go for checkup.
Cause for alarm.
Yeah.
Okay.
Nipples inversion, like the nipple is supposed to be on the outward, and then you find out that now it's getting to the inside.
Okay. Now, allow me to also just pause at that particular point, because this also goes back to, you know, we were having a conversation a while back and looking at breastfeeding. Normally, there are women who have challenges with their nipples. There's some inverted nipples, there are flat nipples. Now, in this case, the inverted nipple is something that has been pointed out here. How do you tell the difference?
Normally, you have a nipple that is
inverted,
but it gets inverted more. You can be able to notice, not the normal inversion. It's like it's disappearing to the inside.
Okay.
Yeah, totally disappearing to the inside.
Oh, wow.
Yeah.
All right. Do we need to lift the board up, kidogo? There we go.
We have swelling in the armpit or the collarbone here.
Yeah. Okay.
If you touch yourself and you find out that you have some lymph nodes that are swelling that were not there,
then you can feel with your finger.
Yes, you can actually feel like this.
Okay.
Yes.
Flat. You place your fingers flat.
Yes, not.
I was poking.
Not poking yourself.
So you feel with the fingers laid flat.
Yes.
Okay.
And also your armpits. Yeah. If you find the nodes, yes.
We are good.
There is also nipple discharge. Mostly it's bloody. Yeah. And probably you're not breastfeeding.
And there's a discharge that is abnormal, so that's a point of concern.
There could be constant pain. Not all breast lumps that have pain. Some are just quiet and they are growing. But if you find out that there is constant pain on the breast that is not easing despite taking painkillers and all that, you need to be checked. There could also be change in skin texture. The orange texture that I was talking about.
Okay. Yeah. Now, how long does breast cancer take to manifest in the body before these signs become very obvious?
There are those that you find that a patient comes and they give a history probably of 2 months. There are those that say, I've had this lump for like 4 years, 2 years. It depends with an individual.
Okay.
Yeah.
Now, I'd like for you to help us know how to do a proper physical examination of ourselves from home before we even get to go to a doctor with legitimate concerns. I have a lump here. Let me go get checked. How do you feel for lumps?
Okay. You can use a mirror at home.
Okay.
As you take a shower. You put your hand, probably Nancy.
We will demonstrate with you as you instruct us.
Yes. You put your hand like this. And
behind your head?
Yes. Then now you start going.
Again with your fingers flat?
Yes, not pointing like this.
Yeah.
Yes, like this.
I'm seeing you doing circular motions. Is that what you're supposed to do?
Yes, so that you can feel.
In circular motions?
Yes.
But it's better when you are bathing with that soap.
With that soap,
yeah. Oh, it slides better and you're able to feel this into resistance.
Yes. Yeah. Then you go round, you check, check, and then here.
Also on the nipple?
Yes. And also you can
squeeze
kidogo
to see if there'll be any discharge.
Yes, and then now the armpit.
Under the armpit.
Yes. Then
you try and feel for lymph nodes. All right.
Yeah.
How long should it take to just know that you've done a proper home-based examination?
For those premenopausal ladies, you can do it on the 10th day of ovulation. That is when. Because sometimes you find there are ladies who say they have lumps on the breast, and most of the time they are hormonal. Yeah, probably before the menses or even after. So on the 10th day, they can do a check.
Okay.
Yeah.
Yeah, hormones can really throw you off the place. Now, given we are paying much emphasis on breast cancer, we also understand that cervical cancer is also another big problem for so many women. It's among the leading forms of cancer when it comes to women. And we also have the doc here today. And just to touch on it very briefly, doc, maybe you could run us through, the dangers that we need to look out for when it comes to cervical cancer, given the human body is just phenomenal. But we need to understand some of these things, and especially for my ladies, as we mark Breast Cancer Awareness Month, let us pay attention to our whole reproductive system. And maybe, Doc, you could just run us very quickly. Before we get to take your feedback, I'm seeing your messages coming in. We appreciate them. We're going to be attending to them in a bit. But let's just talk a bit about cervical cancer and the things we need to look out for as women, especially. Okay, we are the only ones who have cervix.
Yeah.
I don't know why I'm saying especially. Go for it, Doc.
Okay, for cervical cancer, these are some of the common signs and symptoms.
Yes.
You might have unusual vaginal discharge.
Let's just talk about that.
Yes.
What is usual and what is unusual?
Unusual.
Yes, usual and unusual, so that we can tell the difference.
The usual is usually clear, but now the unusual one is something that is foresmelling, prolonged, and it has some color, could be bloody or brownish color. Yeah.
All right, so normal should be clear. All right, so that's symptom number one. If you have an unusual vaginal discharge, you need to get that checked out.
Yes, so that they can rule out infection or even cervical cancer.
All right. Yeah. Now let's get number two.
Number two is abnormal vaginal bleeding. Yeah, despite having your normal menses, if the bleeding continues for long and it occurs many times, like you have bleeding in between your periods, that is frequent, you should go for checkup.
All right.
Yeah. We have the same heavier and longer menstrual periods. That one you've checked. discomfort while passing urine. Like when you're going to the toilet for a short call, you find that you have pain and also difficulty, like probably you're struggling to get the urine out.
Okay.
Yeah.
Uh-huh.
There could loss of bladder control, like you're not able to hold your urine. You just notice you've messed yourself.
Okay.
Yeah. Pain during intercourse. There is also pelvic pain. You might be having low abdominal pains, going to the back, a lot of pain on the pelvic area that is probably frequent and more prolonged.
All right.
Yes. There is unexplained weight loss. You've just lost weight, you're not sick. You've just lost weight, and then probably you're having the other symptoms combined with weight loss.
That's a problem.
Yes.
Okay.
Constant fatigue. You just feel tired. You don't
All
feel
the
like,
time.
Yeah, you don't feel like doing anything. Leg pains. You feel like muscle pains on your legs. Yeah.
Okay. So these are very obvious signs from where I stand, but then again, what is obvious to me might not be obvious to another individual. So if you have experienced any of these symptoms that Doc has just run us through, maybe you could want to go get a checkup to confirm and rule out any suspicions, and especially where cancer is involved, and that is cancer of the cervix. Now, I have some questions coming in, and I'd like for you to help us demystify some of them and to just clear the air. Let me start with Gatero, who is asking, my sister once had breast cancer, and she was told by her peers it was because of wrong innerwear, and in this particular case the bras that we get to wear as women. Do garments have any effect or correlation to breast cancer?
Not really. Yeah.
So that is a myth.
It's a myth.
It has nothing to do with that.
Yes.
Okay. Now Gilbert is asking, how is breast cancer treated in men?
Breast cancer in men.
Yes.
It's slightly different from women, not so much, but for men, the same procedure women go through. It's the same. After they are tested and the results come positive, they might be told to go for mastectomy. Yes. And then after that, they go through chemotherapy, radiotherapy, and probably hormonal therapy thereafter. There are those that are treated with hormonal therapy alone and radiotherapy alone, depending with the stage and the tumor size.
All right.
Yeah.
Now, there's somebody else who is asking, does age matter when it comes to breast cancer, and especially women?
Yes, it does.
In what
also
way?
The treatment criteria is different. Yeah, for premenopausal and postmenopausal.
Oh,
Yeah.
so that determines the form of treatment that is best suited for you, looking
Yes.
at your age.
Yes.
All right. Now, there's a question here for Nancy. They're asking, how did you get through that time? Did you have to go for counseling or support groups to help you navigate those waters? It is hard for some of us.
Yeah, after treatment, I went for we have so many support groups. We have one in Texas Cancer Center. We have in Texas Cancer, it's called Uwezo, where Dr. Joyce is. We have one in it's called Tabasamu. We have one in Mpisha. It's called what?
Faraja.
Yeah, it's called Faraja. So I've been going for so many cancer group.
It has helped.
Yeah, it has really helped me.
Fantastic. So maybe if you did not know any cancer groups that help, navigate those tough waters, she has been able to name some few, and I believe you can also interact with her. We'll be giving social media handles if you have, and points of communication that you can also be in touch with Nancy to understand how you can get this assistance. Now, as we draw closer and closer to the end of the conversation, Doc, what are the treatment options that are available locally in the Kenyan
Kenya?
space? Yeah.
We have surgery, which is the primary treatment. We have chemotherapy, radiotherapy. Those are the ones that I can say they're available here.
All right.
Yeah.
Now, as we also, mark this Cancer Awareness Month, the theme is Give Hope, Save Lives. Let me start with you, Nancy. Looking at this theme, Give Hope and Save Lives, how does it resonate with you? As in, what does it mean to you?
To me, it means I have to create an awareness to the community. I just want to tell them to go for early screening. So if you go for screening, when they detect it early, it's easy to treat. But when it's late, it's not easy to treat. So cancer is not a death sentence. You can be treated. So those people who are fighting cancer now, they should know they should be treated. Even if you look at me, do I look at as a cancer survivor?
Who can ever tell? Who can ever tell? No one
I'm
can.
not. Yeah.
Beautiful. And
so
also,
early screening.
early screening
Yeah,
helps.
it helps a lot. So when it's detected early, the treatment is so easy.
The earlier the better.
The earlier the better. Even
Yes.
if you ask just Dr. Joyce.
And also, I'd like to get your thoughts on the theme. Looking at Give Hope, Save Lives, as a clinician, as a medic, seeing what you see interact with the different patients, how does this resonate with you?
We should encourage the society at large
Yes.
to go for screening. Early detection saves lives.
Early
If the-
detection saves
Yes.
lives. I like that.
If the cancer is detected at an early stage, the chances of cure are very high. Rather than when you go to hospital very late, it will become difficult. So let's encourage our people back there in the villages, even in town, to go for screening. Screening. Yes.
Early detection
Early
will save
detection
lives.
saves lives.
Now, there's Brian who is asking, kindly tell us a bit about the financial responsibility that comes with getting treatment here, and especially in Kenya. Maybe you could just help paint a picture to understand the financial responsibility that comes along with treatment for breast cancer.
Yes, financial issues. Chemotherapy in itself is very expensive. Cancer treatment as a whole is very expensive, but at least we can say the government is helping cancer patients, but if they can put more probably funds towards the cancer patient, like for example now the NHIF fund, they should at least try put more funds towards cancer patients,
All
so
right.
that it can enable them get the treatment without struggles. Because you find that once most of the patients they start their treatment, they're even too weak to go to work. That makes them depend on their families. Probably they are not well.
Yeah.
So if the government could probably set aside some funds for
It
the
will
cancer
go a long
patients,
way.
it will help a long way.
All right. And maybe just your closing message to our viewers today when it comes to this whole month creating awareness around breast cancer. What would you like to tell our viewers today? Here's your camera, very briefly.
So let's go for screening. Let's also give support to our cancer patients as a whole. Yeah, screening is free in most places. So just walk into that hospital, get screened. Yeah, and cancer is not a death sentence.
It is not a death
It is not a
sentence.
death
All right. And also, Nancy, just your message to our viewers today, those that are, just have gotten the news that, breast cancer has been detected, those that have conquered, and those that have not been affected in one way whatsoever, as we mark the International Month around breast cancer awareness. What would be your message to our viewers?
For me, I'm asking the government to put the cancer treatment to be free, the way they have put the HIV. They get medicine and they get treated. There are some patients, if they just know they have the cancer, some just die because they just think that they won't get the resources on how to treat cancer.
All right.
So I'm just asking the government to put it free for the cancer patients.
There we go. I will not add to that. We just want to wrap up this conversation. Thank you so much, ladies, for being with us today. We appreciate your time.
Thanks.
Now, that brings us to a close of Good Morning Kenya. Thank you so much for staying with us. Be sure to join us again tomorrow morning. My name is Jain Wambui. Have a lovely day. God bless. See you tomorrow.